We use the term flexor and extensor. What do we mean by flexor? Flexor refers to the anterior surface of the limbs, right? So this is the flexor surface of the upper limb. This is the flexor surface of the forearm, right? The opposite side, which is towards the back, okay? The back is called as the extensor surface. So when we actually do a movement called as flexion, the flexor surfaces come together and the extensor surfaces are far apart, right? This is reversed in case of lower limb. Now, how do we justify this? Remember, the lower limbs undergo 90 degrees internal rotation during development, right? This brings the back of the lower limb to the front, and the front of the lower limb is actually seen in the back of the adult life, okay? This is because of the rotation that occurs in the lower limb, right? So the front of the thigh and front of the leg are called as extensor surfaces, whereas the back of the thigh and the back of the leg, these are called as flexor surfaces, okay? Flexor surfaces can come in contact with each other, but the extensor surfaces cannot anatomically come in contact with each other. Are we clear? So this is regarding flexor and extensor surface and why the flexor surfaces of the upper limb and the lower limb differ. Then we also have terms like palmar and dorsal. The front of the hand, which is lined by this thick skin, this is called as the palm, this is called as the dorsum. The same term for the foot is used as dorsal and plantar. We stand on our plantar aspect of the foot. The plantar aspect is synonymous with the sole. So the opposite surface we have is called as the dorsum of the foot, right? So this is the difference being the palmar and dorsal, plantar and dorsal. Then apart from this, we also have preaxial and postaxial borders. Preaxial and postaxial borders are used specifically with respect to the limbs. During development, the upper limb and the lower limb, they develop as buds, and these buds are conical in shape, right? The upper border, which is towards the head, is called as the preaxial border, and the lower border, which is towards the trunk, is called as the postaxial border. For example, if I stand in anatomical position, right? I want to identify the preaxial border and the postaxial border. Now, how do I do it? Now, if I abduct my upper limb or abduct my arm, the radial border or the lateral border is close to the head, right? Whereas the medial border or the ulnar border is close towards the trunk. So the lateral border of the upper limb is called as preaxial border, whereas the medial border is called as the postaxial border. Remember, this again gets reversed for your lower limb, right? So the preaxial border is found on the medial side and postaxial border on the lateral side. Again, this is because of the rotation of the limb. Done? So this is what we mean by preaxial and postaxial borders. Done? These terms are specifically used for the limbs. Now if I ask you, which is the preaxial bone of the forearm? What will be your answer? Radius. Postaxial bone is the ulna, right? This is what we mean by preaxial and postaxial. Done. This is regarding description with respect to limbs. Then we also use some other terms with respect to movements that we do. For example, the first or the most major movement that we do is flexion and extension, right? Imagine the elbow joint, right? This movement is called as flexion. When the two flexor surfaces come in contact with each other, we call this movement as flexion. Now, can you tell me what is happening to the angle between the forearm and the arm when you do the flexion? It is getting reduced. So when the angle between the two bones is reduced, we call it as flexion. So flexion can even occur in the fingers at the interphalangeal joints. So whenever there is decrease in the angle between two bones at the joints, we call it as flexion. Suppose the opposite movement, when the angle between the two bones is getting increased, this is called as extension. So flexion is basically a bending movement and extension is basically a straightening movement, right? So if I flex my trunk, this becomes flexion. If I stand straight, this becomes extension, okay? This is the difference between flexion and extension. So this movement I'm flexing the trunk, I'm flexing the neck, I'm extending the neck, right? So this is what we mean by flexion and extension. Increase in the angle between two bones, extension, decrease in the angle between two bones, flexion. Then we have adduction and abduction. What do we mean by adduction and abduction? If we move the limb or any part away from the midline, this becomes abduction. If we move it towards the body or midline, it becomes adduction, right? Even in fingers, if you observe, if I abduct my fingers are moving away from the midline, right? This is abduction. If I bring it closer, this becomes adduction. Okay, so this is the definition of abduction and adduction.